Governor. James, if you could put the first slide up. So I'm going to set the context here to lead up to the guidance for the other one, the gatherings one. So I'm going to set the stage here for what we're going to give you for the guidance for 10 people or less gatherings as you go into Memorial Day weekend. So the CDC, the federal government's Centers for Disease Control, so the national experts on disease management, released today a new report. This is not unlike last week. I had a different infographic that talked about the spread of disease in a group setting. This one came out today, shared an example from Arkansas where two individuals went to, that happens to be a church service, but I'm going to make the point here in a minute, it's not just churches. So went to a church service before they had symptoms. They didn't know they were sick. They didn't think they were infecting people. I highly doubt they had any intention of causing any harm. They went to the church service before the first individual developed symptoms. Was at a Bible study gathering. They went home, he developed symptoms. They shut the church down shortly after this. As a result of those two individuals, it was a married couple, I believe, 35 of the 92 attendees at church, at least 35, developed coronavirus infection. So that's about a 38% positivity rate. That means over a few day period before the first individual developed signs of infection, spread the infection to at least 1/3 of the people they could identify he had come in contact with. Of those third that got infected, 3 died. All right, so 3 people died as a direct result. But here's the thing. So we can talk about making choices that affect ourselves, or we can accept what risk we take for ourselves. But look what happened next. Because those individuals who subsequently got infected were out in the community, they spread the infection to at least 26 additional people, and one of those people died. So here's the problem. Our actions, our individual actions, have direct implications and consequences for others. So when we talk about what kinds of acts of love and caring and kindness we can do, even though it's inconvenient, I don't like wearing a mask in public any more than anyone else does. It is something we choose to do because it's what we need to do to keep ourselves and to keep the people we love and to keep the others around us safe. So I'm going to leave this up here for one more second while I tell another thing, because it's not just about church services, it's about any group gatherings. It just so happens these are the examples that have been published in the last 2 weeks. So in Southern California, in Pasadena, about a week and a half ago, there was news coverage about a birthday party, and the birthday party was held in a private home, and it happened indoors and outdoors, and one member of the birthday party came and was coughing and having signs of a respiratory infection. People were not wearing masks, they were not practicing social distancing, and as a result, 5 people tested positive related to that birthday party, and there were other people who had symptoms but who did not get tested. Now this was, as I understand it, earlier in April when testing was still harder to come by, so not everyone may have gotten a test. So our actions have direct implications on the health and safety of others. So James, if we could show the new slide on gatherings. So this weekend is the first time we're going to permit in Kentucky for the last 2 months or so gatherings of up to 10 people. In order to do this safely, in order to minimize the risk of infection being spread from people to people, and in order to keep people safe and not place people in risk of serious illness or even death, we have to do these things. And they're the same things we've been telling you for quite a while, and we're going to keep repeating them because they're so important. If at all possible, hold the gathering outside. There's a lot more air circulation. It's less likely that the virus will be floating in the air or concentrating. Continue to practice social distancing. Keep more than 6 feet between yourself and other people. So you can have a smaller gathering, just stay further away from each other. Do it outside on a deck, on a patio, in the backyard. If at all possible, wear your cloth face covering. So whenever you are together, whenever you are likely to be anywhere near the 6 feet barrier, make sure you have a cloth face covering on. It keeps you from spraying secretions towards other people and spreading infection. And remember, people without symptoms can have infection and spread it, so you may not even know you're spreading it. Don't share food and don't share utensils and plates, and so just be careful. Take care of your own plates, wash them off, put them in the dishwasher. Wash your hands often and have hand sanitizer available for people so they can use that when they can't go wash their hands. And avoid touching your face, your eyes, your nose, your mouth. All of those are portals where you can inject infection into yourself. So it's Memorial Day weekend. I know many of us desperately crave the company of our family members and our friends. I hope you have a wonderful Memorial Day, but I urge and I ask that everybody please follow these steps so that we can stay safe together and not have serious consequences none of us want as a result. Thank you very much, Governor.